so we ate lunch at Squatters, and as we were walking out of the restaurant, I felt pressure. It was like a sinus pressure, and I thought, oh, that's strange. But Sharon got in the car. I walked across the parking lot, opened the door for her, and got in the car and felt tired, so I shut my eyes. And my thought was, well, I'll just open my eyes and show her. There's nothing, I'm not acting funny. But then when I tried to open my eyes and tried to talk, I couldn't. Especially I couldn't talk. I tried to say hospital, and I couldn't even say the word hospital.
When we rolled up, we saw signs and symptoms of a stroke. We both talked to each other for about 10 seconds, saw the same things, went over it, and realized that he needed to go to a comprehensive stroke center.
I think that the paramedics recognized that he was having likely a large stroke based upon his degree of deficits. So at the onset, he was unable to speak and he was unable to walk. He couldn't use his left side at all. So I think they knew that he was having a large stroke, so they knew they needed to go to a large stroke center. So they brought him directly from Park City to the University Hospital.
Through good communication, we have our suite and all of our folks ready and awaiting the patient, which increases efficiencies. We are just basically standing by, ready to get everyone involved in getting him on the table, getting him prepped out, and going after the clot and removing it fast.
The first step in the acute therapy of Alan's stroke was the administration of intravenous TPA. So this is a medication that we can give within 4.5 hours of symptom onset for individuals who are having an acute ischemic stroke. And what it is a clot-busting medication. It's given through your IV. It breaks up clots throughout your body. So the greatest risk of receiving this medication is hemorrhage, but it's actually a low rate of hemorrhage, and about 3 out of 10 people are better from their stroke as a result of receiving this medication.
We then brought Alan up to the neuroangio suite, which is where we do these procedures, and get access into their arteries, and then thread a catheter, which is a tube, and we bring these series of tubes up into their arteries of the neck, and then use oftentimes a small tube or a stent to basically grasp the clot and pull it out of the body.
I felt quite a sharp pain in my temple, and I said, ouch, that hurt, and Dr. Grandi says, give me a minute, man. He says, we're almost done. He says, hold still, we're almost done. And it dawned on me, I just talked. And so I said, do whatever you have to do, I'll be fine.
The folks who sometimes don't get enough credit are truthfully actually the first responders, because their decision that they made based on looking at a person and treating them like they would treat a loved one could have potentially changed his complete trajectory of his recovery.
To see his recovery and to know that we made the right decision on getting him to a comprehensive center, and that he had, a 98, 99% recovery. I don't know the exact details. I do know that it was very successful to where he's able to travel again, he's able to live his life the way he wants to live, and that's reassuring for us, and it's really cool for us to see.
What a pretty day.